as well.
Yeah.
Okay,
Yeah.
Now try.
there I am. Okay, sorry, it's just so yes, you're right about the dental clinic. Thank you for bringing that up. So I know I only have 10 minutes, right? So I just want to give a quick overview of the clinic and what we do here and how we can help your clients. So I see a lot of familiar names, but also a lot of unfamiliar names on the call. So that's great. So I hope we're reaching some people that maybe don't know all about us already. So we are the free clinic that serves Montgomery, Autauga, and Elmore counties. We have the general setup for a free clinic is that we use a lot of volunteers. And so the vast majority of our medical professionals are volunteers. And so that makes it just kind of an interesting way to work. But we have wonderful doctors, nurses, pharmacists, all sorts of volunteers that provide the direct medical care. And the basic eligibility to become a patient at MOM is to be an adult 19 through to 64. Like she said, children in Alabama are largely covered. Seniors are largely covered, but it's those folks that fall into that gap in the middle that frequently don't have access to regular primary care. And so we serve adults 19 to 64. They have to have no insurance at all. So that's Medicaid, Medicare, VA benefits, or private insurance. So none at all. And they have to make at or below 200% of the federal poverty level. So y'all might already know this, but right now the federal poverty level, or our income guideline, is about $55,000 a year for a family of 4. That's 200%. For one person, it's about 27,000. So of course that number changes a little bit every year, but it's they kind of all go up incrementally over time. So that when a person applies, we have an application form that's on our website. It can be printed out from our website. We also will mail them out. We'll hand them out. We get them out anyway, whatever's convenient for the patient. If you've known about us for a long time, you might have known that in the past, patients were required to come in 1 of 2 days a week and line up outside the clinic early in the morning and bring their application information. We don't do it that way anymore. We do it at the patient's convenience. They can turn their application in anytime we're open, and we'll take that and review it and get back to them if we need anything else. We just stopped all that lining up business. We were going to stop it anyway when we moved our clinic to a bigger space, but we stopped it for sure when COVID came and we couldn't gather people all in one place like that. So the new method works well, and so we've just kept that up. But we do have people, if patients have literacy issues or just trouble filling out applications and paperwork, then we do have people, volunteers and staff members, who can help with that if anybody needs the assistance. So we're always happy to help with that. But the application does require income information, residency information. We require a Medicaid denial letter. And if someone doesn't have any income, then there is a form that they can fill out that shows they get notarized, where someone signs saying, I help them or I provide some support for them. So any kind of support would count for that. So that's the kind of the basic process. When they fill out that application, they bring in the attachments with it. We review it. We have a very close partnership with Baptist Hospital. Baptist reviews it, and then the patient not only is approved for our services, but they also get a charity care letter from Baptist Hospital. So they're able to go and get all the services at Baptist, also at low or no cost, as part of their connection with medical outreach. And so once they have that, we put them on our schedule and they get a new patient appointment, and then they meet their doctor, and their doctor takes it from there. So they may bring them back in 2 weeks. They might bring them back in 3 months, whatever the patient needs. We also provide all their medications from our on-site pharmacy. Also, the other services that we provide right here in the clinic are physical therapy, mental health counseling, diabetes education, nutrition counseling, and like Sherilyn said, we are about to open an on-site dental clinic, which we are very excited about. So it is just about fully set up, and we're recruiting the volunteers to run it. So that's going to be the next big thing in this new year. So I think that's kind of the fast version. Was there anything else in particular you wanted me to cover?
Yeah, we do have a couple things that we need to know. Now, how do people find you? Obviously, clients can call 211 and they can find you that way. What are some other ways that people can find you?
Well, I'm going to put our website in the chat so everybody can see it. We have a page on our website that says how to become a patient. It's linked at the top of the website and then in one of the menus too. So that lays it all out. We're located on Carmichael Parkway. So we are just off Carmichael Road, not too far from the boulevard and the interstate. It's pretty easy to find us. And then I guess phone, website, in person, just drop by, however you want to find us.
That's great. Yeah. Now, you offer just about everything. But what's your capacity like? Like, how many people are you able to help? Do you have a lot of appointments that are sitting empty? Is there a long waiting list?
There is no waiting list at the moment. We have plenty of space in the schedule, so we are actively interested in having new patients. So please send us people that need us. We want to get the services to people that need them. The Medicaid continuous coverage requirement has changed our population a little bit over the past couple of years. You know, I'm sure probably everybody on the call is familiar with that. That people who got Medicaid at any time since March 2020 have been able to keep it and haven't been released from Medicaid. So there's, I think the number of uninsured has gone down a little bit in the last couple of years, but all that's ending March 31st. And so we're sort of already preparing ourselves for a possible influx over the next few months, but that's fine. And we have the space. So we have 9 primary care doctors and plus 2 nurse practitioners, and we have room for new patients. So.
Oh, that's wonderful news.
Yeah.
That's wonderful. Yeah. Now, I've already talked to you about this privately, about how community members can help you. Obviously, medical professionals, you need a lot of medical professionals, but you are also accepting help from just regular people too.
Oh, absolutely. Yeah. I mean, the model of the free clinic is that we run very heavily on the service of volunteers. We have just 9 staff members and more than 80 volunteers. And about half of those are medical professionals. The other half are people who may not have any medical training at all, but they come and help do administrative kind of tasks. Because there's a lot of different tasks that are required to keep the clinic running. Everything from counting pills to screening patients, answering the phone, filing, data entry, you know, there's lots and lots of different things. So we love new volunteers.
We have just a little bit of time. I'm not monitoring the chat. Does anybody have any questions for Molly that we need to get to her before we go to our next person? And if not, there'll be a brief question answer at the end. So if there's something you want to talk to Molly about, it's okay.
I did see in the chat that somebody mentioned they were from a different area. There is an Alabama Association of Free and Charitable Clinics. And so there are 19 free clinics across the state. We're not all the same agency or departments of one agency or anything like that, but we do partner through the association. So if there's an association website, if you Google it, you should find it pretty easily. And you can look on there and see if there's a clinic near your area.
Okay.
Great. That's really she caught what was in the chat. Awesome.
Yeah, fantastic. Okay, let's go ahead and move on to Mr. Terry Reed. So,
Good afternoon,
Mr.
everyone. I'm sorry I'm not on video.
That's great. We're just glad we can hear you. Mr. Reed is with Health Services, Inc. HSI is a federally qualified health center that prides itself on being a patient-centered medical home where the patient is the center of care, receiving a full range of comprehensive services provided by a team of health professionals. Mr. Reed is the Chief Operating Officer and oversees the facility maintenance department, radiology, dental, environmental services, health information management, security, PBX, WIC, One Wellness Center, and the overall operations of HSI's 13 healthcare centers and 3 mobile medical units. So, Mr. Reed, did you see that question in the chat from, let me see, we're talking about the Dothan Wiregrass region? Yeah, Wiregrass Angel House in Dothan. Is that, would that be in part of your territory?
That is not a part of my territory, but I am confident that there is a FQHC that does cover that area. It would be similar to us.
Okay, okay. Well, we'd love to hear more about what you do.
All right. Good afternoon, everyone. Again, my name is Terry Reed. I would like to start off by thanking Mid-Alabama Coalition for the Homeless for allowing me to take a few minutes to tell what Health Services Incorporated has to offer. Our mission statement best describes the organization. Health Services Incorporated is a patient-centered healthcare system, enhancing the lives of individuals and families by providing affordable, comprehensive, and wellness services. A little background, dedicated to providing quality health in areas medically underserved. Health Services Incorporated began in 1968 as a free clinic in the basement of City Hall. In 1970s, it moved to 1000 Adams Avenue and took the name Lister Hill, which, if you were from this area and you've been here a while, that would ring familiar with you. In 2012, they tore down Lister Hill, and then we opened up our River Region Health Center, which is constructed on the campus of Jackson Hospital. That was made possible by a federal grant in conjunction with the city of Montgomery, the county, Montgomery County, and Jackson Hospital. HSI is a provider of primary care services to the medically underserved residents of Montgomery and the surrounding areas, and we are considered what you would call a safety net provider. I would like to invite everyone on this call to visit our website. It's www.healthservicesinc.org. Just spell the word out, .org. Health Services Incorporated provides an integrated approach to healthcare. HSI specializes in primary medical care for the families and children, providing a true medical home. I would like to start off by highlighting our 3 largest health service facilities here in Montgomery. Our home office is located at the River Region Health Center, 1845 Cherry Street. That's here in Montgomery. And I will post this in a chat room later, but our phone number is 334-420-5001. And we are located basically directly behind Jackson Hospital. At River Region, we offer regular and after-hour services. Our adult medicine operates Monday through Friday from 7:30 a.m. until 10 p.m. at night. And on Saturdays, we operate adult medicine from 8 o'clock a.m. until 10 p.m. Our pediatric medicine operates Monday through Friday, 7:30 a.m. until 10 p.m. and Saturdays from 3 p.m. until 10 p.m. Our OBGYN family planning services are offered Monday through Friday from 7:30 to 4:30. Our optometry services are offered Monday through Friday from 8 a.m. until 8 p.m. We just recently adjusted those hours to set up a 12-hour shift so we can catch people during the daytime and again catch them at night. We have pediatric dental services offered here at our River Region facility, and on Mondays we're open from 7:30 till 6:30. That's our only extended hours for pediatric dental. And then Tuesday through Friday, we operate from 7:30 to 4:30. We also have radiology services in-house here, which operate from 7:30 a.m. until 10 o'clock p.m. So if you have those services are needed, we have radiology services available. We also, which is exciting, we have an in-house pharmacy at River Region. They're open from 7:30 a.m. until 4:30 a.m. and they fill approximately 125 prescriptions a day. Our pharmacy offers 340B pricing, which is considerably cheaper than regular pharmacy prices.
You can see
We have We have a courier service that allows us to deliver medication to all of our other facilities, which I will mention later. So they don't have to come to our River Region location. They can actually have these prescription drugs delivered to their health services office of choice. And again, the contract pricing is also outsourced to other pharmacies. So I'm just going to name one off the top of my head. Locations like Walmart, we can also help our patients out with 340B pricing for that. HSI also offers behavioral health services via telepsych at River Region. That is open from 7:30 to 4:30. We are currently in the process of beefing up our behavioral health services. We just recently talked with a psychologist, and we actually have a psychiatrist coming in to visit with us tomorrow night. And again, we're just trying to enlarge our health service, our BHI department, behavioral health department. And again, the other offer that we have here is lab services. Additionally to the services I mentioned above, we have patient navigators to assist our insured patients with referrals. We also have a large case management team that assists our patients that have little insurance or no insurance with getting referrals out to providers, our community partners that are able and willing to assist us. So if we have somebody that needs to go to a heart doctor, we have physicians that we reach out to that are more than happy to help us out with these uninsured patients. So they do a great service for us. And of course, we also have outreach and enrollment services to help get all of our patients enrolled. And that's everything that's located here at River Region. The next location I'll talk about is our Gateway Family Health Center, which is our second largest. It is located at 2905 East South Boulevard, and it's located in the Old Montgomery Mall. At that location, we have adult and pediatric services, and they operate Monday through Friday from 8 a.m. until 8 p.m., and on Saturdays from 8:30 until 4:30 p.m. Also at our Gateway location, we have WIC services. We actually have employees that are health services employees, but they do offer WIC services at our Gateway location Monday through Friday from 7:30 a.m. until 4:30 p.m. And our last large center that we have is the Montgomery Primary Health Care Center. And it's located at 3058 Mobile Highway, and it's actually in the basement of the health department. This location operates Monday through Friday from 7:30 to 4:30 p.m. And at that location, we offer adult pediatric services. And additionally, at that location is where we have our adult dentistry at. So if you have a patient or a client or a relative or something that does not have insurance, that's a good location to refer them to. Now I'll go through our smaller health centers here in Montgomery, and then we'll cover our outer locations. Chisholm Family Health Center is located at 100 Eastern Boulevard, offers adult and pediatric services. They work Monday through Friday from 7:30 to 4:30. We also have WIC services at this location, and that is on Wednesdays and Fridays from 7:30 to 4:30. And again, our Chisholm location is on the same street with the Montgomery Zoo, so it's relatively easy to find here in Montgomery. Our next location is the most recent one that we opened up here in Montgomery was the Montgomery East Family Health Center at 309 St. Luke's Drive, and it offers family medicine again Monday through Friday. The majority of our locations are 7:30 to 4:30. This location here is approximately a half mile from Baptist Hospital. So we do try to strategically place our health centers so that we can better help the community. Health Services also operates 2 in-house school-based health centers at Bellingreth Middle School and at Highland Gardens Elementary School. We have an actual clinic inside of the school. And additionally, HSI services Davis Elementary and Chisholm Elementary with one of our mobile units that we provide. We visit Davis 2 days a week and Chisholm 1 day a week. HSI has one additional health center in South Montgomery, and it's called the Raymer Family Health Center. It's at 5422 State Highway 94 East, Raymer, Alabama. And again, it's a family medicine location that operates from 7:30 until 4:30. HSI has 3 mobile units that we currently are recruiting providers for. We have the River Region mobile unit. We have the Health Services Montgomery Community Response Unit, which is set up for COVID testing. We were able to get that unit through a joint effort with the City of Montgomery and HUD, and that allows us to provide COVID testing in some of our low to middle income areas. And then we have most recently received a grant that allowed us to purchase a community outreach unit, which can go to all of our different 6 county locations. And once it is approved by the dental board, it will be providing dental services at all 6 counties. HSI has 5 additional counties that we work out of. Our Otago Family Medical Center is located at 203 North Taylor Street in Otagoville. Again, it's Monday through Friday, provides family medicine, and it's 7:30 to 4:30. Our Clanton Family Health Center, located at 107 Medical Center Drive, is located in Chilton County, and it is our only clinic on the outskirts that has after hours. This facility offers pediatric services on Mondays from 7:30 a.m. until 8 p.m. And normal hours Tuesday through Friday is 7:30 to 4:30. Of course, our adult location on Mondays only goes from 7:30 to 4:30. And again, pediatric does have extended hours on Mondays. Eclectic, which is located in Elmore County. We have a family medicine clinic up there that operates Monday through Friday from 7:30 to 4:30. We have another clinic in Haynesville, Alabama, which is located in Lowndes County. And again, it's Monday through Friday, 7:30 to 4:30. And again, it's family medicine. We have a wonderful doctor. Dr. Thomas has actually been seen on some national syndicated episodes. So very proud of him and what he's done for that community. But we also have an excellent nurse practitioner down there. Our most recent clinic ad was the Montevallo Family Health Center. And that's located in Shelby County at 33 Salem Road. It offers, again, family medicine and OB services. It is open Monday through Friday from 7:30 a.m. until 4:30 p.m. In addition to all the clinics that we have, we also operate 2 wellness centers, which are like gyms. Our River Region Wellness Center is located at 1765 Plum Street, basically right here behind our River Region Health Center. And it operates Monday through Friday from 6 a.m. until 8 p.m. and on Saturdays from 9 a.m. to 1 p.m. And our Haynesville Wellness Center, which is located again in Lowndes County, it's located probably a half a mile from our Haynesville Health Center. So it's number 10 Pine Street in Haynesville, Alabama. It operates from 10 o'clock a.m. until 6 p.m. Monday through Thursday, and on Fridays from 6 a.m. until 2 p.m. Our centers, because we're FQHC, our centers operate on a sliding fee schedule designed to ensure the availability of quality care and our ability to meet the medical needs of our uninsured and underinsured. Patients' fees are, again, based on the federal poverty guidelines. Additionally, HSI does accept Medicare, Medicaid, Blue Cross Blue Shield, and other insurances. Our minimum sliding fee, once a patient pays that fee, if they're uninsured or underinsured, this covers all the medical services we have to offer, including our lab, x-ray, and various screenings that are done here in-house. In addition to in-house patient care, HSI employs programs to bring helpful information to its communities. And I think that pretty much wraps it up. That's a synopsis, a good synopsis of Health Services Incorporated and what and where we're located at.
Thank you. Terry, can you tell us how people can get to be patients with you? Like, do you have a website where they need to register? Do they need to come in person?
We do. They can actually download it off the site. If you'll give me just 1 second here, I will upload that into the chat room.
So if we find someone who is maybe unsheltered, because we have a problem with people who do not have room in a shelter right now. So if we find someone who is unsheltered and they have a health problem, like they need some help with diabetes medicine, something like that, what would be the best way for them to get in touch with you?
Again, they can go to any of the clinics that I named off, so it doesn't have to necessarily be here at Jackson Hospital. We have 5 locations here in Montgomery. If they have access to the internet, they can go to our website, where you can also download a package to assist you, so that when you come in, it'll already be filled out and it'll help you out with insurance. Help you out with getting your becoming a patient. It'd be a lot easier if you already have that filled out. And there also on the website, there's a list of items that you need to bring with you. So there's a lot of good information on our website.
Okay. What are some of the items that they would need? Because, obviously working with this population, sometimes that can be a challenge. So we might need to know ahead of time what they need.
It is, and I know exactly where you're coming from. They have to complete the HSI patient application, which we can assist them with that. They need a photo ID, social security card, insurance card, proof of address, proof of income. And again, you don't necessarily have to have the insurance card because a lot of people don't have insurance. But proof of income is kind of important. That allows us to utilize the sliding fee program. If they don't have that with them, we can go ahead and see that patient. But again, they will, I think they're given like 30 days to provide that information, a proof of income. If they don't, then the fee goes back to a full fee. So they're helping us and helping themselves at the same time that they bring that in. We ask that they bring all their medications with them in the original containers. That's very helpful to us. And birth certificates for patients under age 18. And again, if they don't have all this information, we will still see the patient and we can refer them to our, give me a second, I'm drawing a blank. We can refer them to someone in our facility that will assist them, our case management team. They're the ones that work with our underinsured and uninsured patients. So, and again, if they have other needs, the case management team is real good about working with them as far as, financial institutions that may be willing to assist, or free, anything that's free that's offered out there, they can assist them with that.
Fantastic. I'm sure that we have a lot more questions for you. Let me check the chat really quickly.
Just a question about, can someone make an appointment over the phone? I think that's what your question is, Dr. Bisbee.
Yes, we do prefer they actually call and make an appointment. That is really helpful. We do provide walk-in services here at our River Region location. And again, walk-in services everywhere, but to make sure you can get in and be seen in a timely manner, we really express that we really prefer our patients to make an appointment. But again, we kind of opened up a semi walk-in clinic here at River Region so that if you don't have a chance to make an appointment, you can just come in and walk in.
Okay, thank you. Let's go on to Ms. Shantavis Carr, and then at the end we will have a brief question answer. So if you think of anything, other questions for him, for Mr. Reed, please go ahead and enter those into the chat for us. Okay, Ms. Shantavis Carr is with the Wellness Coalition. The Wellness Coalition works to improve the health and wellness of people with limited or no health insurance in Central Alabama through collaboration, services, and education. Ms. Carr is a community liaison with the REACH program, who brings her experience of working in professional health settings, clinical-based programs, and community-based nonprofit agencies to help foster clinical and community linkages in the River region. Thanks for coming.
Hi, everyone. Hope you all are doing well. As our moderator just mentioned, my name is Shantavis Carr, and I am the community liaison here at the Wellness Coalition. The Wellness Coalition is located at the Montgomery Health Department. We are on the second floor. So if you come up those stairs, we're the first door to your right. We are open from 8 o'clock to 4:30, Monday through Fridays. And like she said, we focus on improving access to health care for adults with chronic diseases and limited to no health insurance. And my role here, my job here is to help connect healthcare providers, community organizations such as yourselves, and other public health agencies to improve patients' access to preventive services and medical care services. So the first program that I'd like to talk to you all about today is the program that kind of started the Wellness Coalition, and it's our Wellness Case Management program. We actually have two case managers here at the Wellness Coalition. One is located at Jackson Hospital, and the other is located at Baptist South Hospital. And our wellness case managers are placed at these hospitals to help people that are looking to find a medical home, or they don't have health insurance, so they're looking to enroll in health insurance, or maybe they can't afford their medication, so they're looking for medication assistance. We have a partnership with Catholic Services, where we can assist up to $200 with medication assistance, but they would have to go through a screening process with one of our case managers. Anyone who has asthma, diabetes, heart disease, hypertension, obesity, mental illnesses, or any type of chronic condition would benefit from having one of our case managers. If they wanted to get in contact with a case manager, they could call our office here at the Wellness Coalition. The number is 334-293-6502. And if you guys are missing things that I'm dropping, I will definitely drop them in the chat for you to reference. They can also go to our website if they're looking for case management services as well, or they can call 211 and ask for wellness case management, and they will be connected to one of our wellness case managers. The next program or preventive program that we are offering right now is our diabetes prevention program. We have this program through a partnership with BWHI, which is Black Women's Health Imperative, and we are currently in year 6. So this is our last year or last term for this grant term. So we're kind of looking to sustain the program. So we're looking for an employer site to take on the diabetes prevention program. So if you're on the call and you're looking for a site for your employees, please reach out to our program coordinator, Martine Rocker, and I will also drop her information in the chat later when I get done speaking, if you are interested in becoming an employer site for the diabetes prevention program. So just a little history about the diabetes prevention program. This program is offered to those diagnosed with prediabetes by a healthcare professional. It is proven to help participants lose 5 to 7% of their body fat, 10 to 14 pounds if you weigh about 200 pounds, just to put it in perspective for you all. We have lifestyle coaches that teach these diabetes prevention classes that encourage participants to eat healthier, encourage their physical activity, to get them to get that 150 minutes of physical activity in a week. And it's also proven to help decrease their risk of developing type 2 diabetes. This program was designed for individuals at risk for developing diabetes and can prevent the onset or delay of type 2. So we're trying to help them change their lifestyle, change their life. So that's the basics of the program. So who qualifies for the diabetes prevention program at the Wellness Coalition? Anyone who has been diagnosed as pre-diabetic. We have a risk test that people take. So if they score 5 or higher on our risk test, and I can drop that in the chat right now. If they score 5 or higher on this risk test, then they would qualify to enroll in our program. Anyone with a family history of diabetes or anyone that has been diagnosed with gestational diabetes. And gestational diabetes is just another form of diabetes that you have when you're pregnant. So we have a couple of coaches that are currently enrolling classes right now. So we have a Tuesday class at 6:00 p.m. that is currently enrolling participants. And we have a Thursday morning class that is at 9 a.m. And these classes are currently virtual. We're working on getting some in-person classes. We have in the past had in-person classes at the Midtown YMCA, hopefully looking to partner with other organizations so we can bring those people back in person after the pandemic. We noticed that people really hold themselves accountable when they have to show up in person versus over the internet and virtually. And the next program that we have to offer here is the Chronic Disease Self-Management Program. Now, this program is a 6-week program. It's unlike our diabetes prevention program, which is 1 year. If someone enrolls, they would be in the program for a year. The Chronic Disease Self-Management Program is a 6-week program. And in this class or private counseling, participants will learn effective tools to manage and prevent their chronic health issues such as diabetes, hypertension, arthritis, and they'll also learn about healthy eating, safe physical activities for their fitness level, proper medication usage. We want to teach people how to advocate for themselves also when they go into their doctor's appointments and they're speaking with their healthcare providers. And participants in this course will also be asked to make weekly action plans, share their experiences, and just help each other get through problems they may encounter on their healthcare journey. So it's a 6-week course and it is taught by one of our case managers. They would call in over the phone for this class, so they wouldn't have to go anywhere. They could just call into a Zoom number once a week. And in order to enroll in this program, they would have to come up here to our office. Like I said, it's located at the health department, and they would have to first do an assessment just to see asking them a couple questions about their demographics, physical activity, medical care, questions of that such, eating habits. And then once they finish that risk assessment, we would give them a kit for the class. And in this kit, it's basically an outline of the things they'll be learning for the next 6 weeks, and it'll help them come up with a healthy plan and help them reach their goals. We have a class for chronic disease self-management coming up in person on Monday, January the 30th. And it's going to start at 9 o'clock, and it will be here at the health department in classroom 1. We are hoping to enroll about 20 people. The space in classroom 1 holds about 20 people, so we want to make sure we're following those COVID guidelines so people can spread out as they're learning how to become a healthier them. And the final class or final preventive service that I want to talk about is our HeartLink class. We have this program through a partnership with AstraZeneca Healthcare Foundation, and this program helps participants learn tools to manage and prevent chronic health issues such as cardiovascular disease, diabetes, hypertension, and arthritis. The HeartLink program seeks to improve the cardiovascular health and health behaviors of the uninsured adults through access to primary care, health insurance, low-cost medications, community resources, self-management of cardiovascular disease. And this program is available to any adults that are living in Autauga, Elmore, Lowndes County, Macon County, and Montgomery counties. And this program is also a 1-year-long program, and participants that complete the program will receive a blood pressure cuff as an incentive. Are there any questions? That was a mouthful.
That was a huge help. You know what I appreciate is all 3 of you so far have talked about helping people out with their prescriptions. And yeah, that is really, really important. I'm really glad that these options are available.
And I'm dropping the links in the chat right now, and I will also drop my contact information as well.
And of course, the question I ask everybody is how can our population get to you? So they need to come to the health department. Is that the way to enroll?
I'm sorry, you were breaking up. Can you hear me?
Oh, so how would our people who have, yes. Okay, I just dropped my video. Did that improve my audio?
Okay,
phone?
that did,
Okay.
yes.
So if someone is, if someone has housing insecurity and they need some medical help, do they need to come to the health department? Is that how they get your services?
They could come to the health department. They could give us a call. They could go to our website and fill out one of our links that is asking if they need assistance with anything. We have a job form that they could fill out. It'll come right to us. Usually when we receive referrals or when we receive contact from a job form, we get to them pretty quickly, but no later than 48 hours will they receive feedback from us to get assistance.
Sounds great. So we have one more presenter. Let's go ahead and go to Ms. Karen Carr-Turner, who's joining us from Five Horizons Health Services. Five Horizons Health Services is a nonprofit community-based organization that has provided HIV-related outreach, prevention services, and specialized care to West Alabama and East Mississippi, and most recently, the East Alabama Territory, formerly covered by Medical Advocacy and Outreach. Ms. Carr-Turner, sorry about that, serves as Education Outreach Coordinator for Five Horizons, continuing work that she formerly did for the Medical Advocacy and Outreach.
Well, good afternoon, everyone, and thank you for having me. And we are excited about being a part of Five Horizons Health Services. I am still working in my previous capacity at MAO as Education Outreach Coordinator. We provide clinical and non-clinical services. Our clinical services are geared primarily toward those individuals who are living with HIV. And our goal is to ensure that they get adequate medical treatment. We do have social services to ensure that their basic needs are met, and our social services department works with them to ensure that all of their medication needs are taking care of their insurance, that individuals are in, if they're not insured, that we're able to assist them in getting insurance to make sure that they're able to get their medications. Since the change, some of our services have not been started back up, so to speak, if that's a good word, but we are working to continue with all of the previous services to make sure they have food insecurities are met. And of course, we still take care of, to work toward, make sure they have adequate housing as well. But again, we have partnerships with others in the community to ensure that all of our clients are taken care of. We also have a PrEP clinic. PrEP stands for pre-exposure prophylaxis, and it is a medication that individuals can take. It's a pill daily, or we now have an injection that they can take every 2 months. So it may be ideal for someone who struggles taking medications, or who may be transient or in a situation where they're unable to take their medications every day. But PrEP is a pill to take that individuals can take to reduce their likelihood of acquiring HIV. We have a nurse practitioner that oversees that program. So individuals that do decide to get on PrEP are under the care of a medical provider for that as well. We do have a dental clinic, and I do not have all of the specifics on our dental clinic. All of our patients are welcome there, but it is my understanding that we may be taking outside patients as well. I will get that information to you all as soon as possible, so that you could you'll have that information and know how to refer individuals. We also have an STI clinic where individuals can come in and get a 5-panel STI screening for gonorrhea, chlamydia, trichomoniasis, syphilis, and HIV. Those screenings are $50. They can do walk-ins or by appointment. Right now, those tests are being done at our main clinic location at 2900 building, which is directly across from the Renfro's shopping center on McGee Road. I work primarily on the non-clinical side, and I do INSTI HIV testing, which is free. It is an HIV test. It is a screening tool. It is accurate for individuals, and they can walk into my location, which is at 3050 McGee Road, or they can make an appointment as well, and they can get that HIV test done. If that test is positive, we do recommend a confirmatory test, and we will refer them to someone in our intake department. I also go out in the community and participate in community events and do free HIV testing out in the community, participate in health fairs, and I do presentations that encompass sexual health with an emphasis on HIV and STIs. So we are in the process of rebuilding our prevention team. And so I can come out and do presentations. I go to schools, I can go to churches, pretty much anywhere I'm needed to come. I can do small groups, large groups. We also provide risk reduction supplies such as condoms and dental dams. And then of course our PrEP. And we also have pamphlets and other literature. So if there is some literature that you think you may be interested in, we do have some pamphlets, and we could possibly provide you with that information as well. And I can't think of anything else right off, but it is definitely our goal to work with other agencies in the communities, so that if you do have someone who, especially if you have a client, or you may come across someone who is HIV positive, it's very important that you find out if they are receiving care. And if they're not receiving care, we definitely want to get them back in care. And I can be reached and put you in touch with someone on our intake team. Ms. Ali has my information. Right now, I do not have a work cell phone, but I do check my emails frequently throughout the day, as I'm in and out of the field quite a bit, but I do check my emails frequently so I can be reached that way. Or if you just have some general questions or general information that you need to know, I am available. And if I don't have the answers to those questions, I will definitely work to put you in touch with someone that does.
Fantastic. This is very, very valuable information. Can you tell us about how many people you're able to serve at a time? Like, do you have a lot of, like, a waiting list? You remember I asked earlier if somebody had a waiting list. Do you have a waiting list, or are you able to get people pretty quickly?
As far as like for an appointment for which, you just mean general HIV testing, or for individuals who may be living with HIV?
Both, because we're serving populations with all these kinds of situations.
Okay, so for HIV testing, it's there's really no backlog. I'm here from 8 to 5. If I'm not here, we have coverage in one of our other buildings where someone can come and walk in. So pretty much anytime between 8 to 5, with the exception of lunchtime, we are here for free walk-in HIV testing. For intake, that is a question that I cannot answer in terms of where they are on appointments, because I don't make the appointments for that clinical side. So I'm not really sure. However, depending on the situation, I'm sure that our providers will make a way for someone to be seen that needs to be seen, is if it's in an urgent matter. And with STIs as well, there's no waiting list. Typically people come in and they can be tested and they get their results back within 5 to 7 days. If a person is experiencing symptoms, if the nurse practitioner is here, they can go ahead and get them presumptive treatment started.
So with the HIV, is there a wait time? You said with the STIs, there's just a few days to process it.
So the HIV test tool that I use is by Biolytical. It's an instant test. I have one right here. It comes in, it's everything y'all need to test is in this package, so that's why it's easy to go. It is this screening tool will pick up exposure within about 21 to 22 days of someone having been exposed, and they can get the results are instant. If the result is positive, we go ahead and call someone. If the patient is ready to speak with someone, and go ahead and make an appointment, I call someone on our intake team to see if we can go ahead and get them appointments so they can go ahead and get started on treatment.
Fantastic. Yeah. And with modern treatments, this is just completely different ball game. It's not, it's just something that there are a lot of things to do. There are a lot of ways to help people.
Right. And if you have a client, sometimes we just, that's a whole nother conversation in training, but there's a lot of stigma around HIV. If you have a client or you're working with some that really feel like they need a test and they can't get to me or they won't come to me, call me. If I'm in the office, like I say, I have a carry bag that I can grab and go. It's like, we don't want someone that is afraid to come in the clinic to not be tested. If there is, something I can do, if I can come to your office, if they're there in your office and they're like, I really need an HIV test, but I just don't want to go in the clinic. We'll do what we can to, make that happen. I've had to go and test someone in their car. I could not get them to come in the clinic. So I just like, I'll just meet you. I'm gonna make sure that there's a safe place, for me to be, and someone else will know, where I am. But just want you to know, we don't want that to be an issue. If you really feel like that person, needs to attest and they may feel like they've been exposed.
Thank you. Do we have any more questions?
Yeah,
we
we have a question from Tanya Bell.
Thank you, Tanya.
Thank you guys. Great information. I think her name is Karen. So
Yes.
Karen, I do work for the Wellness Coalition and I am here in the hospital.
Okay.
And I've gotten several times where a patient is newly diagnosed
Mm-hmm.
with HIV here. And I've just tried to direct them to you guys, but what is that procedure like? Because we do assist with medication, but of course the medication for HIV is so expensive. How long can a patient expect to be seen that has been newly diagnosed at the hospital with HIV?
So I used to work in the health department as a DIF, so I know just a little bit, but also since I've been gone, some things have changed also. However, that lab result is going to go to the health department. So one of the things that you all can do is do advise them that they will get a call from the health department. Because they will have an interview that they will do with them, but they're also going to try and make sure that they can get them into treatment. You can contact us here, and I can kind of give you that information. You can contact us here, ask to speak to someone in intake, and let them know. And if you're there with the patient, they can go ahead and speak with them at that time, and go ahead and get an appointment to come in. Now, depending on how long the person is going to be in, and depending on what hospital it is, how they kind of, which hospital are you at again? Can you
I'm
say
at
that?
Baptist,
You're
at the
Baptist.
Baptist
Okay.
facilities.
Okay.
I
All right.
cover all Baptists.
Oh, okay. Okay. So yeah, so their labs will definitely go to the health department. Someone from the health department will be calling them. And one of the things that the person from the health department is going to ask them is, have they started their treatment? If they have not started their treatment, they're going to work with them to try to get them into treatment. You can, again, be proactive in reaching out to someone here in our intake team and go ahead and get an appointment for them to be seen. What I was going to say is, if they are in the hospital for something else as well, depending on how long their hospital stay is going to be, there may have to be some, adjustments made. And that right there, I cannot give you a definitive answer on that, because that will come through our intake and provider care services.
Thank you. Thank you. Rebecca Cornwall, it looks like you have a question as well.
Yeah, hi. I'm sorry if you already answered this, Ms. Turner. Are you do you cover the river region or the whole state? Which counties are you covering?
So I right now I do Montgomery County, Elmore, Bullock, Crenshaw. We cover about 29 counties, like a lower Alabama. Otaga, Macon. I can't think of all of them off the top of my head, but we're not just in Montgomery. And
What
again, like I
about
said,
Marshall County or like North Alabama? Does Five Horizons serve up there too, or do you have a sister organization?
we can refer you to an ASO in that area if you have some questions, or you need to send someone to a clinic there.
That's wonderful. Thank you so much. I manage the 211 locally for the 14 counties around Montgomery, but I just want to see if your resource should be statewide or if it should just be. I'll just get that list of 20 whatever counties from you at some point. That'd be great.
That's fine, and you can put my I can put my email address in the chat box, and if anyone has any individual question, again, we have relationships with other ASOs in the state, and we have several people here who may have some professional direct contacts to be able to assist you And if anyone, like you say, if you're ever trying to work with someone in a county that you are not familiar with, we can be a resource to do the very best that we can, because also too, the state Department of Public Health has a program called HREP, and that's one of the things where they're trying to make sure individuals who have not been in care are reconnected with care and get back into care. So we have resources and relationships with the HIV prevention managers throughout the state. So if you ever get stuck trying to help someone, we can definitely, I'll definitely work and do the best I can to put you in touch with someone to help the client wherever they are.
Thank you so much.
Yes, ma'am.
So our time is really short. We're supposed to end at 4, and my clock shows we just have a minute. Is there anything else, Eileen, that you need taken care of? Are there any more questions? Oh, Eileen, not. They're new loud.
Say again.
Okay, Eileen says there's a new effort at Love Loud Montgomery
Thank you.
on
That's what you
Mondays
said.
and Wednesdays during 9 to 1.
Yes, this is an effort that Patrick
And Quiet
Aiken.
Storm Out.
Oh,
Yeah.
I was just going to share that Love Loud Montgomery is filling the gap that River City Church used to fill downtown with services through the week, much like connecting people who can just walk in or they can call, I'm sure, and make appointments. But with agencies like Ross, agencies like Medicaid, agencies like SNAP, I believe that Five Horizons is there every Wednesday. Priority Veteran, United Healthcare. This might be an opportunity eventually for health services and their mobile unit to be at Love Loud. So I put the number and the address of Love Loud in the chat. It's in Central Montgomery on Ann Street. And I'll also put in the chat, we'll be featuring these services in our next newsletter, which we hope to go out, if not this week, next week. And Mr. Rowell,
LaQuanda Hall Chapel. LaQuanda Hall Chapel reminded us that priority veteran will help. They will help
we're having trouble with the audio.
and Mr.
Hey, Sherilyn, we're not able to hear you.
Yeah, your audio.
I
is
think, why
not-
don't you read the rest of the notes?
Yeah, just
Okay.
people can reach out to Mr. Rowell and Quiet Storm Outreach. He and his volunteer team are always ready to share hygiene kits. And we have your contact information. We do have your contact information in the chat for Mr. Rowell. So thank you all for being here, being a part. Thank you to the presenters who shared such detailed information. I did make a recording of this call. If anyone would like a copy, I'm happy to share it. And we look forward to announcing our next resource hour soon. But on behalf of the Coordination of Services Committee of MACH and our director, Lydia Pickett, thank you for being here today. Thank you, Sherilyn, for your excellent facilitation.
Thanks for having me. It was really enjoyable.
Thank you.
Okay, thank you. We'll see y'all next time, I hope.
Thanks, guys.
Bye-bye.